Hello, today I'm going to be talking to you about hypertension. Hypertension is typically a disease that affects primarily the older population, but it can affect all other age ranges as well. As a nursing student, I think it's important to be able to talk about hypertension and talk about how it can be prevented since it is so easy. Did you know that hypertension is referred to as the silent killer? This is because many people don't go to the doctor often enough, and then by the time they get their blood pressure checked out, it ends up being too late and complications can have occurred by that point. I'll show you what hypertension looks like. So hypertension's the narrowing of blood vessels. So this is a normal blood vessel that's uninterrupted. This is a blood vessel that has a bit of a blockage here, and that's referred to as atherosclerosis, and that increases blood pressure. So as I said, complications can occur from high blood pressure, like stroke and heart attacks, but they can be easily treated with medications and prevented with diet and exercise. So myocardial infarction is a heart attack. There's two forms. There's a STEMI and there's a non-STEMI. STEMIs are treated by inserting a stent into the heart, and as well as giving morphine, oxygen, and nitroglycerin. A non-STEMI is just treated with morphine, oxygen, and nitroglycerin. Nitroglycerin works to increase the blood vessels in the heart so that blood can flow easier and oxygenate the heart. Morphine reduces pain, and giving the person oxygen puts more oxygen into the blood. I'll show you what a STEMI and a non-STEMI look like here. So this is a regular sinus rhythm. You have your S and your T wave here, which are at the baseline, and then with a STEMI, you have an elevated ST wave, which indicates that parts of the heart are beginning to die with lack of oxygen present. Another complication that can occur from high blood pressure is a stroke. There's two different types of strokes. So there's a hemorrhagic stroke, which is where a blood vessel in the brain bursts and leaks blood into the brain, causing damage to the tissues in the brain as it puts extra pressure. An ischemic stroke is where there's a blood clot in the brain, and thus the brain isn't being perfused with oxygenated blood, and damage can also occur from that. With hypertension, people often experience vision loss as the blood vessels in the eyes become narrowed, and this can interrupt their sight. So hypertension is treated with medications often. The first couple that's treated with is ACE inhibitors and ARB blockers. So these medications work by preventing angiotensin, which is a hormone that narrows blood vessels. So it'll increase blood vessels and thus prevent hypertension. A few side effects that people experience with these, though, are a cough and low blood pressure. Another medication is a calcium channel blocker. Calcium channel blockers work by increasing the diameter of the blood vessels in the heart, and thus blood can flow easier in the heart, and the heart doesn't have to work as hard then. So high blood pressure or hypertension can be prevented as well. It's often prevented with diet and exercise, like a low-fat diet and an hour of exercise each day. So I'll show you here. So low sodium diet works to decrease blood pressure by 2 to 8 millimeters of mercury, and exercise works to decrease it by 4 to 9 millimeters of mercury. So hypertension is a bad disease that affects many people, and I think as a society and a healthcare system, if we can get a better handle on it, then we can save many lives going forward. Thank you.